So that's really interesting. So think about that for a moment. And I know I, there's no scientific method about what I'm going to tell you right now, and it it's just I see this in the clinic a lot. But look at what you just said there. It took a long time,
Yeah.
and you said like 7, 8 months, 9 months, right?
Um,
You were on the birth control pill for how many years?
7.
So how many months is that? Compared to it took a long time because it took like 8 or 9 months. So you see what I mean? Like it's about perspective. And when you put the two together, a lot of the times, and I'm going to say this again so that YouTube knows that there is no scientific method about this at all. But a lot of the times in the clinic, you can, this is actually something that was a consultant in the IVF clinic that told me. But, apart from all that, it's a very, very rough rule of thumb. It could take you the same amount of months to
Mm.
get anything back to any sort of normality as the years that you're on the birth control pill.
Well, we talked a lot about the benefits of acupuncture, but is there a chance like there's side effects or any like could it worsen symptoms of PCOS in some people? Like anything to be aware of, negative or
Wow, that is yeah, that is a very, very good point to bring up and to make people aware. So the answer to that in particular with PCOS is yes, it can. Now, w- again, it's all about how you frame it and what you expect.
right.
So would I be super surprised that if someone had already a history of acne or any skin issues, that that would be aggravated when they're getting their treatments? I would not be one bit surprised.
Mm,
Remember, we're trying to use at that point with their cycle, we're trying to use acupuncture to influence the hormones as much as possible. Those are the same hormones that cause those issues to your skin, right?
mm,
So sometimes, yes, you could have issues. Hey, by the way, I know sounds like I'm defending acupuncture, but this is not specific to acupuncture. Remember what we said about metformin? What do a lot of people experience with metformin? It's good for them and
right.
they need to be taking it. But when they start taking it, it kind of makes them feel a bit funny.
Mhm.
It's the same thing with everything. So particularly, I would say for sure with in terms of PCOS, the one that I would think about the most, headaches, especially at the second half of their cycle, because that's when the more progesterone would be around. And if they are prone to headaches, I would not be surprised if they would be experiencing some headaches at that second stage of the cycle. I'm not saying it's going to happen to everyone, by the way, but I wouldn't be surprised. And skin issues, because again, yeah, we're going at we're going at those volume knobs for the hormones, and at different stages of the cycle, we're trying to turn them up and turn them down.
Yeah.
There's going to have this cause and effect happening in the body. So those would probably, if you can think of, now you're making me think about people in the clinic and going, yeah, someone who hasn't had a bleed in a long time could have a really painful bleed the first time. Could they say that, oh, this is because of the acupuncture?
Mhm.
Again, this is why it's important to talk about expectations in the clinic.
Yeah, that makes
These are conversations that we have, and I would say, yes, it doesn't happen that much with ovulation, like compared to someone, for example, with endometriosis, which is different. Where someone with endometriosis, they would probably notice that their pain around the ovulation might be a little bit more. Remember, with PCOS, ovulation is not really the ovulation itself is not really the main issue, is the building up to it,
right, right.
right? The follicles, a lot of the times the follicles are there, they're just not like dominant follicles ready to go. So not so much around ovulation, even though I could probably think of a few cases, but definitely at the start of the cycle, especially for those that haven't had a regular menstrual cycle or that haven't had a bleed in a long time. That first one can be a little bit tough. Not being too graphic, but just for those who know what I'm talking about in terms of, patient wise, they will know what I mean about that. The first few days, that blood will be clotty, it'll be sticky, it'll be dark, it'll be drier. So as you can imagine, from inside of your body, that's like ripping and pulling and going. Whereas a menstrual cycle that is more regular, the blood flow will be more blood-like,
Right.
so easier to move. Yeah.
Okay, good to know. Good to know. Few more questions. So we talked a lot about, getting pregnant so is acupuncture safe to do while you're pregnant? And are there different variations between the different trimesters? And are there any areas of the body that should be avoided?
Yes. Wow. Yeah. See, it's always, we always know when someone is asking you questions that they know a little bit about acupuncture, because that wouldn't be something that, just someone would think about. But yes, great question. Can acupuncture be used during pregnancy? Yes, it can. At any stage of pregnancy, yes, it can. Nurses and midwives use it a lot, and not just acupuncture, but even towards the end of pregnancy, you would have things like moxa being used for breech pregnancies and stuff like that, and that would be done by midwives a lot of the times. Are Does it change during the first few weeks of pregnancy? And I hesitated there because I never, again, it's just because of that trauma from the clinic of seeing and being so excited about someone sending you pictures of a positive pregnancy test or having those first few weeks. I'm always very aware that not all of those continue. So I always try not to get too excited and to allow to be carried away with that, because it's almost like just wrapping them around cotton wool for those first few weeks. Um, During the first few weeks, nothing really changes that much. And if you think about what's happening in terms of implantation and development, it, there isn't that much happening that is changing in the body. Things are still too small. We're still talking about blood supply there. We're still pretty much talking about what it was after ovulation or after embryo transfer, right? It's uterine blood flow, right? A lot of the times you're talking more about calming down the person and relaxing them, because they will be nervous as well,
Right.
because they might be their first pregnancy ever and they're really conscious about it.
Mhm.
So during those first few weeks, no. Around the 8 week mark, going into the 10, 12 weeks, yes, a little bit more. Um, you, you start, you don't really use points in the belly anymore, and a lot of the times you go, and it's funny because when you're teaching this to the first years, it's like they go like, oh yeah, because of the baby, and you go like, no, because everything is moving out of the way, so the points are not in the same place anymore. So
Mhm.
no, it's not really because of the baby. But yeah, so points in the belly, not really. And are there any points like the forbidden points? There's a lot of debate about that. um, you don't do strong points on people that can't take strong treatments. That's like just obvious anyway, right? It's like treating a child versus treating an adult. Of course the treatment's going to be different. Even if you're needling the same point, you might not be stimulating the same level if you're treating a kid, or if you're treating a pregnant person, if you're treating an adult. So it does change a little bit as the pregnancy progresses. Yes, the acupuncture changes because the the issues that that person is bringing to the clinic also change, right? They're now not talking about hormones that much anymore, because there isn't that much hormone changes. It's pretty much more of the same hormone. But they're then talking about things like, typically in the clinic, especially as the pregnancy progresses, back pain, sinus pubis issues. Actually, even at the start, you can have things like with nausea, hyperemesis. One of my colleagues did the master's. She was on the cohort before me. She's very well known for being a midwife, and her master was actually on acupuncture for hyperemesis as well. And yeah, as the pregnancy progresses, you're really kind of working on with what the person brings. Could be things like with headaches, not sleeping well, back pain is quite common as well. And then you get into the preparation for birth, and that's, you can see the smile already. That's the beauty of it all. It's amazing to see. You're there for the whole journey, and it's great. It's amazing.
It's exciting. Awesome. Okay, good to know. So if I don't know, are there any acupuncture points that, like, we could do at home by ourselves for anything to help with PCOS? Or I know, like, sometimes I don't know, one of my friends told me she's acupuncturist, like, over here, if you press that for headaches, but I don't
Yeah.
know if there's anything for, like,
See,
PCOS.
you don't see it on camera, but I'm doing that every once in a while. On that particular point, it's probably that a few years ago there was this running joke amongst researchers that it's like if I read another paper about that point, I'm gonna need to needle that point because like. Can you not just study any of the other points as well? But yeah, you don't see it on camera, but here I am doing that. Um, yes, but again, can I just put that big warning and the big caveat there that it's
Mhm.
not because of putting pressure on one particular point, or again, it's not like doing acupuncture once a week that it's going to, turn everything into magic and be okay. I think so. So what I normally say for people with PCOS, I always say be comfortable with their body, especially with their abdomen. Things like, does it feel cold? When you put pressure, does it hurt? Does it hurt in any particular places? Think about the belly button area and then work from there. Do you, I say this in the clinic so many times, do you even know when I say symphysis pubis, do you know where that is? you know, so just really being comfortable with it and not only knowing the region, but also knowing and putting pressure there and feel what it feels like, right? Um, so yeah, from things like having the palms of the hands and putting pressure, and then just going with the fingers or the thumb and putting a little bit more pressure. Can you close your eyes and imagine, like, do you know where your ovaries are? I know that they're deep inside there, but if you put pressure, does it feel? Because remember, it's going to get some warmth there. It's going to get some blood circulation there, right? Like when you put pressure, you see that the skin gets red. So things like, especially around the belly button area, I would always tell people in the clinic to just be super familiar with their body around there. And start with something, sometimes a bit awkward. So like, what do you want me to do? Do I just go and rub it? No, I don't want you to go and rub it. I want you to feel it.
Mm.
Put your hands there. Does it feel warm? Does it feel cold? Does it feel like even your lower back? Does it feel warm? Does it feel cold? Do you move around and go like, oh, it's kind of warm here, but then it gets really cold there? So get familiar with that. And for sure, any kind of, especially for that, like really call it the complicated stage when you have someone who's not menstruating, or at least not menstruating regularly,
Right.
for that stage where you're really waiting for that day one, for sure, putting pressure. You've heard this a lot of the times with applying heat as well. Any movement there will help. So for sure, yeah, I wouldn't be, points like in the forehead or even that point in your hand. You can do that. No, no, seriously.
No,
Like I didn't want to be. I
it's
don't want to be dismissive like that. I know it does help so much so that I'm doing it. But if talking about PCOS in particular, I would definitely say with the
fun.
abdomen.
Yeah, definitely. Good to know. Well, those are all the questions I had. I don't know, is there anything else you wanted to cover? Oh, I think you were mentioning, so like, can you go to any acupuncturist if someone is interested, or do you have to find someone that specializes
Yeah,
in
I had to stop myself from asking you questions because normally I'm the one asking questions as well, and I'm like, I want to know your experience from someone with PCOS going for acupuncture, and what is your experience? But yeah, one of the things that I did mention, and I say this all the time, and again, this doesn't come from a place of this is not my soapbox, but think before talking about acupuncture, think about you
Mhm.
going to your MD, going to your general practitioner about a menstrual cycle issue. That person may or may not know enough to give you some hints, but you'll be better off going to a gynecologist,
Right.
right? To start with,
Yeah.
and then it could be something more reproductive, and then you could be moving on or REIs and all that sort of stuff. But it's not wrong. If you have a pain in your back, like for example here, you would probably go, would you go to your GP first? But then it's like the GPs will say, well, kind of you're better off going to the physiotherapist, or you need to get an MRI or an X-ray. There's places to go to, and with acupuncture, it's a little bit like that. If it's something, I don't want to say like it's not too complicated. If your menstrual cycle is irregular, like it's happening, but it's irregular, you could get help from, an acupuncturist without any particular specialization. But again, we come back to how long is it going to take to find the fault? Like it's like bringing your car to the mechanic that knows everything about your car, or bringing your car to the mechanic that is more general. And they will probably find it, but it'll take them a little bit longer. So when it comes to particularly with the fertility side of things, because there's so many medications involved and there's this multidisciplinary approach with the fertility clinic as well, I always say that if your goal ultimately is you have some menstrual health issues going on, but your goal is that that needs to be sorted because you're thinking about getting pregnant, you would be better off finding an acupuncturist that actually has done training on that because it'll save you time.
Yeah,
And
no,
a lot of the times we get those people coming to us that they went to acupuncturist XYZ and they do more pain or they do more,
I was gonna say, yeah.
whatever it is. And they go like, you know what? This person would be really ideal to look after you because I know a little bit about it, but they are really focused. And that would be the same thing with an MD and a gynecologist. So,
Yeah, makes sense. And I think, like you're saying, a lot of acupuncturists, they focus on pain, and this is
mm,
something different. So it makes sense that you might want somebody that has a little bit more experience and, education or research done with those specific points with fertility or PCOS.
yeah, and really, to be honest, more so than that, I'm really thinking. I know it's bringing it back to the work that I do, but bringing it back to that multidisciplinary approach.
Hmm.
Right? I wouldn't expect, even out of respect to someone who is like the best acupuncturist in the world treating pain, or like one of my colleagues doing the masters, she her specialities in insomnia. I wouldn't be expecting her to know everything about a treatment protocol in the IVF clinic because that's not what she does. You know
Right.
what I mean? Like
Yeah.
it's my expectation wouldn't be like, oh, you should know this because you do acupuncture after all. Well, not really. The same way that if I had someone like that really needed that help with anxiety, I would probably go and call her or contact someone that I would know that had special training in that. So it's just kind of like to do with timing of it all and just having that specialist approach to it. So yeah, and working together.
Yeah, makes sense. Makes sense. So, I mean, I can share a little bit about my experience now with acupuncture.
Yeah, yeah. That's important. How did you get to go to acupuncture in the first place? That's always something that I'm really fascinated to ask someone going for acupuncture.
Yeah,
Was it
good question.
someone told you, or
Well, so it was, I started like a year ago, basically, but with my PCOS story, I was on birth control for 7 years. I didn't really know or understand. And then once I still started experiencing symptoms despite being on birth control. So then I decided, I didn't know that those symptoms were related to PCOS. I thought it was like a normal part of life, but like, I had difficulty losing weight. I was starting to get hair loss, acne, mood swings. I had gained weight that I couldn't get off. And so it's all of those things. I was going through like life changes that caused my PCOS to get worse. I started looking into PCOS, and this was like right before the pandemic, like March 2020. So then I was trying to get help from other providers, but it was hard to get appointments and things like that because it was that weird phase where things were
yeah,
like, didn't know if it was going to go virtual and not seeing new patients, et cetera, lockdown. So then I was kind of doing my own research, and I decided that I started making lifestyle changes. So I did that for like about a year, with sleep and stress and changing my diet and exercise and all of that. So things had gotten a lot better. I lost some weight. My symptoms were getting better. So I decided that I wanted to come off of my birth control to see, how my cycle was doing without the birth control. So that went well for like a few months. I got off of my birth control and I started getting cycles, but then they started getting longer and longer and longer, like, 20 something days, then 30 something, then 40 something. And so I was like freaking out. So then, I don't know, I guess Facebook groups, maybe people were saying to try acupuncture. So then I started looking at, acupuncturists around me and people that specialize in like PCOS or fertility. And so that's when I started going to acupuncture. And, like we've been talking about, it wasn't like just that one thing that like fixed all my problems, but obviously I had to maintain the lifestyle
Yeah.
changes and things like that. So that I've been doing, but then recently, like even my acupuncturists have told me like, like I'm going actually once a week. So maybe I need to consider going more. But they even told me like, there's only so much we can do within the time that you're here and you have to continue to
Yeah.
maintain your lifestyle, work on my stress, work on my sleep. So those are things I'm still working on.
Yeah. Yeah, that's it's almost like we can play this clip at the start, and then we can go through the questions you were asking me, and it's me trying to give really that sense of a lot of the times I mentioned that in the clinic to say to someone, and I can use this clip now from you and going, you see, it wasn't a silver bullet. There's no such thing as a silver bullet,
Wow.
right? And by the way, what I really appreciate from your story and for people to know, as I was saying, like it's so important for someone like you sharing your story as well. Things change.
Yeah.
You stop the pill, and then it wasn't just everything goes back to normal. It sometimes it takes longer. Sometimes it is okay for a few months, but then it changes after that, and you have to kind of adapt to that. I wouldn't be so just to be clear on what you were saying about the 2 times a week or more times a week, that is something that is really for those scenarios where, as you can imagine, like the cycle is going into your 40 something days, 50 something days, and you're really starting to think that at that point about how much of that dosage, like that treatment once a week, is it really impacting as much as you would like to at that point? So it really depends. So I can't talk about it too much because we're working on the publication of it. But one of the things that came up from my study that was really interesting was it wasn't a clear cut that the acupuncturists, and by the way, these were all acupuncturists as fellows of the ABORM. So with that special training, it wasn't a clear cut that they were saying 2 or 3 treatments a week. Actually, they were saying 2 or 3 treatments a week until ovulation.
Mm.
After that, it was like some of them were like, after that, yeah, we can go with one. It's fine. But
Yeah.
it's up to that crucial stage. So for sure, yeah, if someone, please listen to this, you have to do the lifestyle changes. It has to be there. It has to support. Those changes are what's supporting your changes as well. And
Exactly.
before you share more of your story, can I just say it is so common, and especially for younger women coming into the clinic that have been on the birth control pill for a long time, it is so common. And you can imagine, as me being a man having to explain this, that when you're on the birth control pill, that is not a regular cycle.
Yeah. Yep.
That is a bleed. That is not, do not, I tried to kind of like teach them to stop saying that, oh, my cycle was regular while I was on the pill. It's like, no, 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 no. That wasn't a cycle. That was a bleed. Then we'll start talking about menstrual cycles. And yeah, there was your example there being a great example for people to realize.
Yeah. And now, like, you know, that's that was also something, unfortunately, like you said, a common misconception that it regulates your cycle. So I thought, okay, I'm fine. But then when I realized that it doesn't and you're not ovulating, and I have a whole different YouTube video on that. But yeah, and so that's why I was like, maybe I should come off of the birth control pill and see how my cycles are doing. And based on that, I can also know like, hey, this is amount of stress my body can handle, or I can't handle this much stress because I know my cycle is going to be off. And so I'm happy I came off of the birth control, even though, obviously at times my period is more unpredictable now. But for me, that's something that I need to learn more about, what lifestyle changes I can maintain and need to maintain to have that regular
Mhm.
cycle.
Yeah. Uh, w- I know, look, I don't want to be disclosing your whole life here, but what what did you use as, and what was your encouragement for those lifestyle changes? Because that's something that I find in the clinic that it's very difficult to say to someone, start here or do it because of XYZ. Like what got the ball rolling for you?
I think, well, It was the fact that I kept getting told that, "Oh, you're on birth control, you're fine." Like, my doctors had told me that, "Just take birth control until you wanna get pregnant, and then, like, until then, your PCOS is fine." And I kept thinking that, "Oh, well, things are fine." But then the fact that I was having symptoms despite being on birth
Yeah.
control and, then I'm like, okay, well, how much is this really helping? It's not helping anymore. And realizing that, yes, I mean, for people that want to be on birth control, it's fine. It can help. But, like I had those lifestyle changes that caused my PCOS to get worse, or life events
Hmm.
that caused it to get worse. And then I realized, like, okay, the birth control is not helping. On top of that, I'm not ovulating, and I've been on it for 7 years, and I want to know how my cycle is doing. And then just learning that a lot of PCOS can be managed with lifestyle changes and not having to resort to being on pills. And, like, eventually I want to get pregnant. And obviously that means I can't be on birth control. So I was
Yeah.
like, might as well start seeing how my cycle is doing sooner rather than later.
What was the hardest thing for you at the very start? What was the big hurdle?
When I came off of birth control,
Yeah.
well, I lost a lot of hair actually,
Okay.
and that was really, 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 really hard. I lost even more hair, and I think it had to do with just the changes in the hormones and trying to
Yeah.
get, like that cycle, the natural cycle to come back. But yeah, that was really the hardest. It took a
Yeah.
while, honestly. It took like 6 to 9 months after stopping birth control to actually not see that hair loss anymore and see more of that hair coming back. But
So that's really interesting. So think about that for a moment. And I know I, there's no scientific method about what I'm going to tell you right now, and it's just I see this in the clinic a lot. But look at what you just said there. It took a long time,
yeah,
and you
too
said like
long.
7, 8 months, 9 months, right?
Um,
You were on the birth control pill for how many years?
7.
So how many months is that? Compared to it took a long time because it took like 8 or 9 months. So you see what I mean? Like it's about perspective. And when you put the two together, a lot of the times, and I'm going to say this again so that YouTube knows that there is no scientific method about this at all. But a lot of the times in the clinic, you can, and this is actually something that was a consultant in the IVF clinic that told me. But, apart from all that, it's a very, very rough rule of thumb. It could take you the same amount of months to
Mm,
get anything back to any sort of normality as the years that you're on the birth control pill.
yeah, that's a good point. I've actually heard that. So basically, like if you're on it for 10 years, then it might take you about 10 months to actually, yeah.
Yeah, because what do you start training and go and run the marathon tomorrow, or do you start? You go on a diet and start losing weight today, and tomorrow you lose all the weight. Again, it's all about our perception of time and how our body reacts to things, and that was kind of like why I was asking you what was the biggest hurdle, because that is where that's where a lot of the times people will just go, okay, I can't do this, and think about your example. It's affecting the way you look, right? And it's your hair, like it's important to you. And like the question you asked about someone is getting treatment and all of a sudden you say, well, your hormones are much better now. Or, you go and do your blood test and it's like, wow, your panel looks amazing, but you're all red with spots and your hair is falling. You go like, oh, I don't feel great, I want to stop this. So it's that balance, right, between what's the expectation here. And really one of the things I wanted to say to you there, as a big warning sign again, is yes, you were on the birth control pill for all those years, but maybe that was good for you.
Yeah,
Because can you imagine if you weren't and there wasn't any bleed at all?
yeah, no, I agree.
That would that be better? You don't know, but I don't imagine that that would be any better to not have any shedding of the lining of the womb for X amount of years or once or twice only a year
Yeah, exactly.
compared to being on the birth control pill. It's like, okay, it's a necessary evil. We'll deal with it, right? So yeah, it just triggered when you said about the amount of time it took. I was like, oh, there's another one of those that it could happen like that. So yeah, for sure.
Yeah, I think with birth control, as long as people know and are educated about it and choose, if they choose to do it, they do it with the education, like, knowing those things. knowing the side effects, knowing that it doesn't regulate your hormones, knowing those things, and then if you choose to be on it, yes, and it can help your symptoms, yes.
Yeah. Again, yeah, it's like when you're talking about that care for someone with PCOS, it's like having, if you need help with your metabolism, really having the help of someone who is really good at looking at the dietary aspects of your life, and looking at what exercise suits you, looking at, if there's something to do with the hormones, making sure that you're getting the proper support from that aspect as well. It it's like it's what makes me angry when I look at that research saying that it might take 2 to 3 clinicians before you get a diagnosis, and there I am thinking, well, you would need those 2 or 3 clinicians to work together and to help you with the diagnosis. Why are you being just kicked from one to the next one and being told that it's normal, or just go on the birth control pill? Just go on the birth control pill is not the long-term solution. And remember, PCOS doesn't go away even after pregnancy or at menopause. There are still issues after that. And let's look at the person on the long term rather than we'll just dampen down the symptoms for now.
Exactly. Yep. Yeah, we can talk a whole different conversation about that.
I know, yeah. And this is, again, I can go back and say that that's why it's so important for the community to hear people like you sharing that experience, because I'm in the clinic, I hear the stories, and I can be upset, I can be angry, and I could, try and do something and change something about it, as I am, trying to make a difference. But ultimately, you reach the community, and you sharing this makes it more, that it makes it more normal, but it makes it easier for someone else to hear it and go like, oh, that sounds really similar to what is happening to me. Maybe I should get things checked,
Yep.
right?
Yeah.
So yeah.
That was the whole reason, because I felt really, like, alone through it all and just, like, "How come I'm the only one going through this?" And but then I'm realized, like, I literally cannot be the only one going through this, and that's why I decided to start the YouTube and the Instagram, and it's been really good for me and, connecting with other women that have PCOS, so it's been good overall experience.
Yeah. And similar to me with the acupuncture side, and even with starting the acu vlog as well. So the acupuncture vlog was actually, by the way, another project from the master's degree. And it was pretty much like, I I'm saying this in the clinic all the time. Maybe if I record this and just have it out there, then people hear it and go like, "Hey, I don't have to say this again. I said it already, and it's recorded." And yeah, that was kind of like the original idea, was just to put it out there in that sense of the questions that you were asking me today, or the questions that we were getting online all the time, and just put it out there and talk about it in terms of, talk about it with words that people would understand. Even, when you're asking me about what it does, and I'm starting to talk about electroacupuncture, and I'm starting to talk about sympathetic and parasympathetic, and I'm like, don't use those words, because that is just, it's confusing, and that's not the point. It's like getting them to be okay talking about it, and what the points are and what the points do. It's I'm really lucky that in my lifetime, and from the time that I graduated to here I am now, and still studying and still looking to do more research, going from a point where when I started, that the conversation was pretty much about, oh, does this work? Now we're talking about, oh, how does this work? And it's really fascinating to have this aspect of all of us working together. And yeah, it's super interesting, and having the voice from the patients as well to help with that. It's Yeah, I think that it's amazing.
Well,
I love to hear the stories, and I could nerd out about stories with PCOS all night long.
well, that's great. I like to hear that, and we definitely appreciate the research and work you're doing. So I was going to ask our last question: how can our viewers connect with you? I know you mentioned the Acu blog.
Yeah, the active vlog. Yeah, that's, so I had to kind of stop that over the last while, because writing loads, and um I I had this plan of trying and slowly just bring it back again, but unfortunately the day still only has 24 hours, so
Yeah.
it's really difficult to get everything done. but yeah, so the AccuVlog still has some of the videos still out there. I actually to make it to separate like the clinic work from my own work and from my own research. The clinic is still acupunctureclinic.ie, and it's .ie because it's here in Ireland. So the acupuncture clinic is the acupuncture clinic, and that's more like that's work and how people can reach out and get to us. And then I created at sandrograssa.com just for me, and in terms of that's where this part of lecturing and the research and everything is going to be more focused. As for the acupuncture vlog, I would love to have more time to do it. I really love these conversations, and yeah, unfortunately, it's just a matter of time. I still post loads on social media. People know me even from evidence-based acupuncture as well. Um, yeah, so people people can reach out.
And though, what about your Instagram? What is your
Yeah,
handle?
Instagram is just Sandro. I think it's Sandro.grassa. Yeah, they can see, and AccuVlog is also on Instagram as well. Yeah,
Awesome. Okay, so I'll link them in the description
yeah,
box.
absolutely. Thank you.
Thank you so much, Sandro, for this educational conversation. I definitely learned a lot, and I'm happy that our viewers now know that there's other options like acupuncture and or Chinese herbs and things like that that they can add on to managing their PCOS. So thank you so much for this conversation.
And thank you so much for sharing. I was looking forward to asking you some of the acupuncture questions as well. And yeah, it's a pleasure to be here and a privilege. Thank you for letting me speak to your community.
Well, if anyone has any questions, leave them in the comments section. And if you guys enjoyed this video, make sure you give it a like. If you're new here, make sure you hit subscribe. And as always, be kind to yourself, be patient, and focus on progress, not perfection. Thank you. See you next time.